Hello friend, welcome to the channel Pharmacy Dictionary. In today's topic, we are going to discuss about the drug addiction, their basic introduction and few causes and their prevention too. First of all, as usual, we have to understand the meaning of today's topic. The topic is drug addiction. That means it is made up of two words. The first one is drug. As you know it, drug is any agent which is used for diagnosis, prevention and treatment of any disease or disorder is called drug. But please take a pause. Drug is having two meanings in the same word. The first one is therapeutic drug, which is called prescribed drug or prescription drug, which is being prescribed for the treatment of any kind of disease or disorder or their management. But there is another drug which is called abusable drug. Means these are not suitable, not good for your health point of view, and these are not prescribed by any medical practitioner. These are called drug of abuse or abusable drug. So this word drug addiction is applies or amplified for the both of the cases. Now the second one says addiction. What is the simplest meaning, English to Hindi meaning of addiction is called lat lag jana, which has become a part of our daily habit. This is called addiction. There are so many types of addiction. It may be of your game, it may be for your study point of view, it may be for the game or other kind of activity which you are like to do every time, most of the time of your day. You utilize that particular time just for that particular purpose. This is simply considered as a addiction. It means a condition, a situation or object without which we are very difficult feeling to live without that. So this is called addiction. Suppose I am having addiction to watch movies every Saturday, every Monday, every day. Each and every day I used to watch movies, but in some circumstances if I am not able to watch a movie consecutively 2 to 3 days, I will feel very unanxious and I will feel that what is happening with me. So I am addicted to particular drug, or I am addicted to particular television, or I am addicted to addicted movie, or whatever could be the reason. That condition at which you cannot live without that particular object is simply considered as an addiction. But today's topic is strictly related to the drug, that is either prescription drug or drug of abuse. So what we are going to study about the causes, their symptom, their mechanism, their risk factor and different approaches for the treatment as well as their prevention. So first of all, let me explain you the common definition, we can say bookish definition of this drug addiction. When person believe that optimum state of well-being is achieved through the action of drug is simply known as a drug addiction. Suppose I am not feeling well, I am feeling very low, I am feeling very sad, and I visit to any physician. He prescribed me few medicines which is very good in nature, they act very good as per expectation level. Now I am feeling very energetic, very excited. This regimen has been finished. But now again I think that I am feeling very low, I am feeling very sad, shallow. Then what should I do? I should take this drug again. That is my belief. It is not actual have to be. It is not actual process or actually. This is a myth of myself. So I thought whenever I took that medicine I was feeling well. So now I am not feeling well just because the regimen has been finished. So what I will do? I will restart to taking that kind of drug either by prescription or without prescription. I may arrange that drug from anywhere by my applying any kind of approach, but I will depend on that particular drug. So I am depending on the drug and I am thinking, I am believing, it's my strong belief that I was feeling good just because of that medicine, and if I stop taking that medicine I will not feel again good. So this is a problem. This can be converted into drug addiction. So second point say personal emotionally distress if the drug is not given or not taken. Suppose someone has not given me that particular drug, I am not able to arrange that particular drug, I am failed enough to arrange that particular drug, so I will feel very bad, I will feel so sad that I could not arrange that particular drug. So this is my mentally ability to unwell myself. It is my disability, I can say, which is not feeling well. It is not wrong in your body, nothing is wrong in your psychological condition, but that is your false belief that you were feeling good just because of that medicine, and that is converted into drug addiction. As you can understand this definition, you can assume that this was earlier termed as psychological dependence. It's not actual physical need, it's not actual the desirable of particular drug. You are feeling good, nothing is wrong with your body's function, nothing is wrong with your biochemical parameter or physical state or biochemical state or any other kind of hormonalization station in your body, but you believe, that is belief is based on psychological. So earlier this drug addiction was termed as a psychological dependence. because psychologically you were dependent upon any kind of drug, so you believe that that drug can only make you feel better. That was not actually right, that was just a false belief. That is called psychological dependence. So now we have some example of that particular drugs which may cause drug addiction. Now let me clear you about the types of drug. There are two types of drug, actually I explained in the starting. Once when you visit the doctor or any physician just because of any problem, the doctor will prescribe you suitable drug which is suitable at most for that condition. If you take that drug, you will feel better and you will continue taking that drug without prescription beyond the limit of prescription regimen, then it may cause drug addiction or several other type of problem. Apart from that, most of the drugs are from prescription and few drugs are drug of abuse. So let's give the example, amphetamines. These amphetamines are example of central nervous system stimulant. So if any patient is having kind of depression or starting phase of depression, he or she visits the psychotherapist, he will prescribe some kind of central nervous system stimulant, and on top of that prescription, amphetamine may be one of them. So he or she will feel better after taking this kind of drug. So this drug may be now converted into addiction for that particular person. Now next one is cocaine, is an important and potent drug for the analgesic activity. So it may relieve the pain, and some people will continuously utilize this kind of drug to get relief of any kind of pain because that were given a good response for that particular condition. So they become addicted for this kind of drug. Next one is cannabis. As now anyone is knowing about this cannabis, it is available easily without applying much more effort. It can be arranged. So it is one of the important abusable drug or drug which is converted into an addiction phase. Next one is alcohol. Every country, every state, every particular village is having a liquor shop. Either it may be a desi liquor or it may be English wine shop, but it is easily available. No need to do anything. Just go and purchase that kind of medicine. It is medicine too in pharmacology. But if you take this alcohol in excess amount for the abusable purpose, for achieving pleasurable purpose, that will be completely converted into drug addiction, and that is not good. So it is example, it is a good example, I must say. You have seen so many people who are continuously, every day chronic alcoholism has been developed inside their body. They used to take alcohol while getting up, while sleeping. They used to alcohol like water. So this converted as an addiction. If you try to withdraw that particular alcohol or you try to withdraw any of the drug from the addicted person, they will show withdrawal symptom, and that may be another dangerous problem for them. Like if you withdraw the alcohol, if you withdraw the amphetamine, they will start showing you conversion like activity, aggressive activity, and different types of other unexplainable activity they may show after withdrawal of this kind of drug abuse or drug addiction conditions. Next one is CNS stimulant. Although amphetamine is an example of CNS stimulant, other type of CNS stimulant which is having property to cause addiction may be problematic for this kind of patient. Anti-anxiety drugs are those drugs which are used to relieve the anxiety condition. Anxiety is unwanted, unnecessary feelings of fear without any logical reason. This is called anxiety, and to reduce the anxiety, many people are utilizing this kind of drug. So this may be converted into addiction phase, and if you withdraw the drug, if you do something alteration with that kind of drug, you will give placebo drug, the problem may arise like withdrawal symptom. Next one is mood stabilizer. Although all comes under the CNS drug, the mood stabilizer are those drugs which can stabilize your mood. What is the meaning of stabilization of mood? Suppose someone is having different kinds of activity, mood swing we can say, bipolar disorder. So in some phase he is very excited, he is very happy, but just apart from the few minutes he will or she will feel shallow, sad, dull, or whatever activity other is there. So this is kind of bipolar disorder or fluctuation of mood. So if particular person want get happy, become happy, live happy, he or she should stabilize that mood which is of good nature, that is happiness. That drug is called as a mood stabilizer. Most of them are central nervous system stimulant somehow. Now next is the mechanism of action, how we feel pleasure and how the addiction of any drug took place. So see, I am going to explain you with respect of two conditions. The first one is for normal condition. It's for me, it's for you, it's for all of us. Why we feel happy? When we feel happy, what is actually happening when we feel happy? So this is say natural signal. Natural signal means all those things which are happening all around us. We have different types of sense organ. Like we can see, this sight is one of the most important our sense organ. Second is hearing, tasting, and many other things. But I will use hearing purpose. I will use the sight purpose only. If I am seeing something going on very good, someone is coming to me and someone is just making me happy. Someone is asking for me. Someone is giving giving me benefits, someone giving is my appreciation, and different type of activity which is entering my central nervous system either by sight or either by visualization or audition. So that signal reach to my brain, and you know it, there are so many points of brain, hemisphere, lobe, which make you happy according to signals comes towards them. So the brain is having reward point. So brain will give you the reward. What will be the reward? You will start feeling good feeling. That is, good feeling is your reward actually. If someone is demanding you, someone is saying once more once you're singing, then you will feel courage, you will feel happy. If someone is clapped for you, then you will feel happy. So you can see that condition, and that make you ultimately good feelings. This is a natural phenomena. So what is happening here? The brain and reward point are very crucial and important for making you happy. But in that particular cases where you addicted particular drug, just to repeat this phenomena, just to repeat this feeling of happiness, what will you start? You will start taking a particular drug which will make you happy. So that drug may be of two types. The first drug is of prescription drug or drug of abuse. Prescription drugs may be a central nervous system stimulant, anti-anxiety, mood stabilizer, or anything else. But abusable drugs are not actually prescribed drug. They may be used for another purpose, like codeine phosphate, like Corex, which are not prescribed for any person to having a central nervous system activity. That codeine drug is used for the cough suppressant, but some people use it for central nervous system stimulant purpose or having pleasure or having fun. That is called abusable drug. So what will these drugs, either prescription or abusable drug, will increase the threshold of the brain reward point. What is the meaning of threshold reward point? Suppose this is the pen, I am pushing this in my palm or over the hand of my body, so it will cause pain. So this is simple threshold. But if I am taking kind of analgesic drug or local anesthetic drug, I need to prick more deeper to get the same pain, but I am here increasing the threshold. So minimum potency of any brain or any part to recognize the level of happiness is called threshold. But we are taking drug of addiction, then this drug may increase the threshold of reward point. So you will feel happy, but it will take more time, it will take more amount of drug. So this will convert it into multiple use, because you are not going to satisfy with single dose. So you will take it many time, as many time as you can. So this will increase the multiple use, and finally will cause tolerance. So this tolerance can other problem which have to study over the next classes. Tolerance will be the next topic upon. Next one is causes. What are the basic causes for this kind of drug addiction? There are two types. One is pharmacological and second one is psychological. So pharmacological will be a next topic in our upcoming syllabus, because this was just introduction, definition only. So let's discuss about the social and psychological issue. The first one is individual factor. Individual factor means a person's own factor. If a person is of high moral value, he will not go for such kind of drug addiction activity. But if the patient is of so-called moral activity, he or she may fall into this kind of unwanted track. So this may be problematic, and this factor belongs to himself or herself. Second point is family factor. If in family of any person, this is usual, drinking alcohol, taking different types of addictive drug is common. It is happening just before them, just in front of them. So this may cause themselves to use such kind of drug. That's called family related factor. And social means there are some rare species in which this is very common, like consuming alcohol is a very traditional value. They all family members consume alcohol together. This is a social phenomena. So in this case, that may be possible to get addicted with such kind of drugs, alcohol or any other type of drug. Now next one is symptom. What are the basic symptoms? There are so many and number of symptoms, but it is not possible to include all of them. So I have concluded and included only few of them which is easily can be detectable, which is easily identifiable. The first one is isolated feeling, isolation. If someone is having fun with a group or friend circle, but nowadays suddenly he has withdrawn herself from that particular group or circle, now he is starting living a isolated manner. He is not concerned with his friend and family. This is one of the important early symptom of drug addiction or drug abuse. Now next one is negative thought. He or she will continuously think about negativity. He will think that I am not able to do that, I will not do that, I will not be successful, I will die, I will do whatever the feelings are, all will be summarized as a negative feeling. Next one is drop in attendance or performance. If you are talking about the college student, then their attendance will be gradually down, or suddenly they will withdraw their education system. Or if you are talking about the professional who are working in the office or any kind of organization, they will, or their performance will maybe decrease. They will not be able to give their best. That may be possible. There are so many things, but I'm not going to touch much detail. Next one is loss of self-control. The person will lost control over himself or herself. See what is happening on us. Suppose I'm going to do something wrong. I know this is wrong, but I'm going to do something wrong. So I will take a pause. I will think, I'm doing right thing or wrong. If I said wrong, then I will withdraw myself from that bad activity. But if I'm not worried about this good thing, bad thing, I will just go for that. So this will cause loss of self-control. I will not be able to control myself to not to do that thing, to do good things. I will be no any control over myself. So these are the basic symptoms. Now let's talk about the treatment or precaution or prevention. See, treatment is a medical point of view. Treatment is not as better than prevention. It is already said prevention is better than cure. So we have to procure that particular person with different types of activity, like find out cause. We should find out the actual cause. What is the basic cause for that particular addiction? Is this lies between this? Is there any family, social or any other issue? Or let's just try this kind of phenomena is there. So we have to find the actual cause. Then we have to solve that particular problem with healthy discussion, with the counseling with particular person. So this is the find out the cause. Next one is love and support. We should trust him. We should love him or her. We should support him or her. We should not ask him suddenly to withdraw a particular drug. We should not strike him. We should not say bad word for them. Just be with them, love them, support them, and ask them to leave such kind of not good activity. Next one is medicine. If nothing is happening after counseling, then you have to go for the medicine, consult any specific psychologist or psychiatrist. Next one is rehabilitation center. Above all, not working case, then you have to admit him or her in rehabilitation center so that they will treat accordingly the person's nature, need and problem condition. That is individualized therapy, I must say. So these were some points regarding drug addiction. I hope you will get the point. All these are excess in amount. We have to explain just definition, but I try to make you clear the concept. I hope you will get the all point. So at the last, thank you very much for watching this video. If you want to take the screenshot of this whiteboard, you may have after some time. The reference for today's topic is P. Jagdish Prasad and K.D. Tripathi. Latest edition, that is 8th edition. Thank you again.